2021 is almost over. We experienced so much this past year as a country and here in Ohio, from an attack on the Capitol to the rollout of the COVID-19 vaccine.
The question that I get asked, of course, every day is, when will my group be able to open up? When will I be able to get a vaccination?
To another surge of cases.
22 months of this pandemic has taken its toll on our healthcare workers.
This morning, we look back at the year and ahead to 2022. Thank you so much for joining us today for Face the State. I'm Tracy Townsend. To get perspective from both sides of the aisle of 2021, we talked with Herb Asher, Professor Emeritus of the Ohio State University Department of Political Science, and Republican strategist Terry Casey. The first topic of discussion, the January 6th attack on the U.S. Capitol. What lessons are there to be learned from that incident?
For January 6th, it kind of fits the title of that movie, Dumb and Dumber. Clearly, some people did some stupid and illegal things. And I kind of use the sports analogy. There's a lot of people who don't take losses well. I can remember some University of Miami fans from the championship game and Michigan fans who didn't like a official's call. But in this case, there clearly were a lot of federal judges and local judges, many of them appointed by Trump and Republicans, who said no and stop, and that there wasn't evidence there. So hopefully we've learned some things, but you don't want to do dumb things again.
One lesson we should have learned is that democracy can be very fragile, that it is actually possible for a small group of people in power, including the former president and his allies, to basically try to overturn the results of a legitimate election. It is such an awful set of events that the people most responsible for it, you might say, were really committing treason. It's really disloyalty to the United States of America.
The next topic encompasses all of 2021, the rollout of the COVID-19 vaccine and how it divided the nation. We asked how the politicization of the pandemic affected our ability to move through it.
Sadly, we've had the vaccine and things related to COVID politicized, and it's happened on both sides. We can argue who was a bigger offender one way or the other, but even Democrats and Republicans now are agreeing this is going on too long. But the sad news, kind of in the predictions for the future department, we're probably going to be in a situation where we're going to have boosters every year given. We're also going to have to do some testing on if you've had COVID, did you have any immunity and how long does that last? And also, if you look at Ohio, there's some dramatic differences based on geography, rural versus urban areas, and then demographically, there's a lot of different groups, young and old and other categories, where there's very different results and impacts. So unfortunately, COVID's gone on too long. I can remember when we thought it was only going to be 2 or 3 months. Now it might be 2 or 3 years, and clearly the numbers are ramping up. And the big thing to watch is hospitalization, because cases, if they're milder, might not be quite as dangerous, but when people have to go to the hospital, when they impact the ICU wards and elective surgery, that's when it really gets difficult.
It's such a sad commentary that public health and public safety, vaccinations and masks have gotten so weaponized, so politicized. And in part that has happened because throughout the last 2 years of his presidency, Donald Trump was sort of, again, didn't take the virus very seriously. The one thing he did do that I thought was very good was to really encourage the development of the vaccine at warp speed. And but then the whole notion of saying people should get vaccinated, be a leader out there and encourage that. And his typical response was, well, do it if you want.
Finally, the fight over district lines in Ohio. It's an issue that gained national attention. So how likely is it that Ohio's new redistricting map is struck down by the state Supreme Court? And why?
Under the constitutional amendment, it's very clear that the court just can't grab it, appoint a special master, and draw it however they want. They can point out examples of fix this and fix that in a House district or a state Senate district and send it back to the committee and tell them to fix it. What I think is going to happen is that the Chief Justice is going to express her frustration at the way the amendment is written, the way certain things were done, the lack of bipartisanship and coming up with a 10-year plan. But the Chief Justice is very well aware there's an upcoming deadline in early February where candidates have to get filed. They have to have their residents in place, and we got to have an election. We just can't say we'll keep the state reps that terms are going to be up in a year, and we'll keep them for another year while we argue it out in court. And then we've got congressional districting waiting in the wings too. So the elections are coming, and that's going to force the hand of the court. And again, the specific language in the constitutional amendment, people love to quote one or two sections without putting it in context, that in section 6 says you can only follow that in attempting after you've done sections 2, 3, 4, 5, and 7. Minor details, but legalities matter.
I think it's very likely, and I think it's very likely because it basically ignores the constitutional amendments that the voters of Ohio approved. Now, the problem becomes, what happens if the court issues that ruling? What will the legislature do? Will they go back and just tinker a little and give something back that's still unconstitutional?
All right, so next week we will talk about 2022, specifically the midterm election, the U.S. Supreme Court abortion hearing in Mississippi, and the governor's race right here in Ohio. Perhaps when you look back at 2021, you feel like this.
I know that for so many of us, dealing with COVID is something that we're just getting tired of having to do.
We talk with the Department of Health Director Dr. Bruce Vanderhoff about how Ohio handled the vaccine rollout this year. This week, more than 1,000 National Guard members reported to Ohio hospitals to help with staffing shortages. They're doing jobs like cleaning and driving patients. 150 of the National Guard members are highly trained medical professionals and can provide relief for nurses. Governor Mike DeWine made this call as hospitals across the state are seeing record levels of ICU admissions, and COVID-19 case numbers are at their highest point since December of last year. In this pandemic, what made 2021 different from the year before was the rollout of the COVID vaccines. 10 TV's Lindsay Mills spoke with the Department of Health Director Dr. Bruce Vanderhoff for a look back on the year and his message for 2022.
Let's start off with going back to January of this year, and the rollout of the vaccine was underway. What were your thoughts during that time? Were you feeling a sense of hope?
Absolutely. You know, the vaccines came to us at a very important time. We were seeing a very high wave of hospitalizations and deaths. And there was no indication that that wave was going to slow down at any time soon. And it was right at that moment that our vaccines came on the scene, and they worked incredibly well. So in the early weeks of rollout, the rollout went very well. And then adding on to that, the clinical impact of those vaccines was evident literally within a matter of weeks of their rollout, where we saw some of our most vulnerable populations have marked improvements in hospitalizations and in death rates.
At what point did it turn to there was more supply available of vaccine, but less people were willing to get the vaccine?
Yeah, so, you know, the vaccine rollout proceeded very, very well. And we knew that there would come a point where there would be a shift from vaccinating those who were eager to get the vaccine to now beginning the process of developing a sense of confidence among those who were more on the fence about a new vaccine. And we really began to approach that point in the late spring, heading into the summer. But, you know, I think that was to be expected. We certainly were fully anticipating that we would reach a place where essentially those who were enthusiastic, those who were eager to receive the vaccine had gotten their vaccine. And now the larger work of helping more people in the population understand the vaccines, understand their remarkable efficacy and the remarkable safety profile.
And somewhere along, the summer into the fall, we started hearing about boosters, more and more about boosters, as we were dealing with Delta, as we were talking about how to get kids back in the classroom. And so for you, what was that time like, dealing with those three topics all at once and having to navigate us?
Yeah, well, we're very familiar with boosters. And as we think about boosters, we all know from getting shots throughout our lives that boosters tend to be something that are needed for various vaccines. So I don't think any of us in the medical field were particularly surprised that we reached a point where it became evident that there was some waning of the protection that we were getting from our primary series of COVID-19 vaccines, and that a booster was going to be needed. The problem is that, as is normal, our availability of antibodies in our bloodstream does begin to decline over time, which with the Delta variant, given how aggressive it is, has then created more opportunity for even vaccinated people to get the virus and spread it to others or develop some mild to moderate illness themselves. And so what we found was, but a booster bumps those antibody levels right back up and provides great protection.
As we go into this new year with this new variant, with hospitalizations being as high as they are, what do we need to do? What are your thoughts?
Well, the good news is we have the tools that we need, beginning with the vaccination. So my number one recommendation is, if you haven't gotten vaccinated yet, please go out and get vaccinated. It's never too late.
And Dr. Vanderhoff, my last question, looking back on the last year, is there anything that you would have done differently? Anything you would change?
I think that we have done a pretty good job in the face of something that was a virus no one had ever seen before, a virus that was not well understood or characterized. And I think that what we in public health and certainly here in Ohio have aimed to do from the beginning has been to share what we know, be honest about what we don't know, and as tools become available, especially the vaccines, to be honest with people, share with them what we know about the vaccines, how they work, their safety profile. And so I actually feel pretty good about how we have approached something that was totally unknown and had a profound impact on healthcare and healthcare delivery in a very short period of time.
That was Lindsay Mills talking with Dr. Bruce Vanderhoff. We also reflected on 2021 with the Lieutenant Governor.
Every day that I spend is about how I can leave the pandemic in the past, recognize that we're in an endemic stage where this is just going to be with us, and learn to live with it.
What he had to say about job creation over the past year and the response to his controversial Wuhan virus tweet. Well, there are just a few days left in the year 2021, and we wanted to catch up with our key political leaders here in the state of Ohio and take a look back at the year and some of the highlights and the challenges that we faced as a state and in the pandemic. 10 TV's Clay Gordon sat down with Lieutenant Governor Jon Husted.
So we've been a year in the pandemic since the vaccine started rolling out here in Ohio. From your perspective, 2021, compare that to 2020 from a leadership role. Well, what was that like for you?
Well, it went from 2020 when we didn't know what we were dealing with to a crisis that we didn't know what the solution was to managing the solution in 2021. The vaccine changed it all because we could now protect ourselves. In 2020, we had no protection other than distancing and masking and washing our hands. In 2021, we had access to a vaccine that worked, that either kept you from getting sick or at least limited the opportunity that you would get severely sick, which could enable people to resume much of their normal lives, to go back to work, to do family gatherings, to begin to socialize and resume the lives that they remembered. And so instead of being in crisis management, we were in opportunity management, where we were trying to promote it, get it done, get life back to normal, which is a much better place to be than what we faced a year earlier.
One of the hardships you and the governor are facing now is Senate Bill 22 to limit the power the governor and the state health department has. That was passed and vetoed, passed again. We've heard from the governor occasionally about this. Where do you stand on Senate Bill 22?
Well, look, Senate Bill 22 doesn't affect anything right now in terms of how we're managing the pandemic because we have the vaccine. The only thing with Senate Bill 22 is you never know what's going to come next. You never know if there's going to be a new type of disease, virus that's out there that we will need to respond quickly to. So this is the nature of how you make public policy. You manage it, you have reactions to it, but for now, Senate Bill 22 is not creating any management problems for us as it relates to any of this. Look, we're trying to move on. Every day that I spend is about how I can leave the pandemic in the past, recognize that we're in an endemic stage where this is just going to be with us, and learn to live with it as healthily as we can, and allow people to return to their social and economic lives that they had before. And that's just the nature of where we are at this phase.
And part of getting back to normal is getting people back to work. Let's just talk some figures for a second. The latest figure that I have is from October, 5.1% unemployment. That's down from September. We've talked about this before. There's 250,000 open jobs in the state right now. It's a record. How are we trying to get people back into the job force?
Well, yeah, we're creating jobs in Ohio faster than we can find people to fill them. Just to put this in perspective, on unemployment compensation, we have 50,000 people in Ohio, which is really historically low. We have 150,000 jobs just on OhioMeansJobs.com that pay $50,000 a year or more, 250,000 jobs total. I can't believe how quickly we've recovered, frankly. I remember sitting there during the pandemic where we 2 weeks earlier had record low unemployment, and then literally in a 2-week period went to record high unemployment. I thought it would take a decade to recover. Largely, we are recovered in terms of people who want jobs being able to find them. But we still have challenges, and then a lot of people left the workforce and aren't coming back. And every business that I talk to today will, no matter where I go, whatever industry sector it is, they're like, I have jobs open, I can't find people to fill them. We are all hands on deck with trying to provide job training opportunities to try to connect people who maybe left one industry sector to get them connected to another.
There's a gubernatorial election next year. You and the governor planning on running for re-election, right?
Oh yeah, we're putting the campaign operation together and just honored to have so many people who are out there helping us and willing to support us for another term.
Why do you want to run again?
Well, it's a pretty easy question because we have a lot of things to accomplish in Ohio that are still not accomplished. COVID did distract us a bit, but we never took our eye off the ball. We are focused on the innovation economy, we're focused on the workforce, I really believe that the next 10 years in Ohio create an enormous opportunity for us to reshore things that have been being produced overseas, that companies now are saying we want to manufacture those things in America, that Ohio is uniquely positioned to win that.
Is there any possibility of you breaking off and trying to run for the governor's seat yourself at some point?
Oh, goodness, no. Governor DeWine and I are going to run for re-election. He's going to run for governor, I'll run for lieutenant governor, and then what happens beyond that, well, we'll let the future work itself out.
Well, let's touch on something back in the spring. On March 26th, you tweeted a comment, shared an article about former Centers for Disease Control and Prevention Director Robert Redfield telling CNN he believes the coronavirus originated in a lab in Wuhan, China, despite having no evidence. This tweet received a lot of criticism, specifically in the Asian American community. Many called it offensive. Now, I know you've had private discussions with them, a lot of groups since that day. Is there anything that you want to take this opportunity and say publicly about maybe some of your comments?
Look, the Chinese Communist Party created this global pandemic by concealing it from Americans and people from around the world. They mishandled the situation, whether the origin was in the Wuhan lab or the Wuhan market, that's where it came from. That's the nature of what I was trying to explain. I believe that the Chinese Communist Party, in many ways, is not being held to account. I think more American corporations need to be held to account. That was the nature of my comments, and I stand by those because that was the point I was trying to make, and I think that whatever we are, 6 months later, it's even more true now than it was then.
Is there any way you would have handled that situation differently?
I probably would have inserted the word lab, but other than that, I mean, there were others who were trying to distort that as meaning something else than what it did. I was focused on the disease, the cover-up by the Chinese Communist Party, and that's it. That's what the focus was, and I believe it was true then and it's true now.
So you do not think it's necessary for any sort of apology?
No.
Is there any message you want to say for the Christmas time for our viewers during this time? Yeah.
So look, this is a time of year when we reflect on our past and have the hope for the future. And I want to wish everybody happy holidays and Merry Christmas. And remember the people who are less fortunate. It can also be a lonely time for people who maybe don't have the support of family or community. Don't forget about them. Reach out to them. Help put a smile on someone else's face by your show of kindness during the holiday season.
Thank Clay Gordon for that report. A view of 3rd District Congresswoman Joyce Beatty beyond the steps of her start at the State House. She shared her journey to the U.S. Capitol with Columbus Monthly.
Never in my wildest dreams would I think that I would be walking into the United States Capitol, going to the White House, sitting down with the President of the United States, riding on Air Force One and Two with a Black Vice President. And so when I read the article, it was breathtaking to read about yourself in the way that the article was written, to talk about your successes and to talk about your challenges and the things that you had to fight for and fight against and stand up for. But I think it shows the nation, and at least the state of Ohio and our community, that if you stand up for justice, you can make a difference.
And Congresswoman Beatty says her work is about having the courage and commitment to take action. We thank you all for joining us today. Remember, if it affects you, your family in Ohio, we are certainly here to make sure those accountable face the state. Have a great day.